Hi, I'm John Steury. My wife Vera and I live in the suburb of Karen, which is outside of Nairobi, Kenya. From this location, we oversee the work of World Gospel missionaries, or what we now call global workers, here on the continent of Africa. Several have asked how the COVID-19 pandemic has impacted us and the work of our missionaries here in Africa, so I wanted to give you just a brief update. For Vera and I, it basically has meant that we shelter in place here at our home. That's where we work out of, in our home office here. For me, it has changed my life in that it has added many hours of Zoom meetings to my agenda each day. Between that and email, though, I'm able to keep up with most of my work, and things have carried on pretty much as normal for us, except for the fact that we're not traveling basically at all, and we usually do travel quite a bit. For our missionaries here in Kenya, this could mean quite a big addition to their workload, as many of them work in healthcare. Many of you know about Tenwick Hospital, which is our large mission hospital here in Kenya, and a lot of our missionaries work there. However, so far in Kenya, the progression of the pandemic has not really taken off. The cases are starting to add up and to increase significantly, and just within the last week or so, Tenwick has seen its first cases of COVID-19. But when it does increase, as we anticipate that it will, that will mean a lot of extra work and a lot of challenges for our missionary personnel who are working in our mission hospital there, as well as another hospital called Chogoria Mission Hospital in northern Kenya. In Uganda, during the first days of self-isolation, our missionary team kind of banded together and did a social media campaign that resulted in raising about $20,000, which will go towards helping our national pastors and their families and other means of outreach among the people of Uganda. And finally, our one global worker in North Africa, a young lady nurse, is active at a hospital and is contributing there, not only at the hospital, but in other ways within her community. And the Lord's using her and the rest of our global workers, even during these days of lockdown. Thank you for your prayers, for your support, for your encouragement. We greatly appreciate every bit of it. Vera and I send our greetings and love from Nairobi, Kenya. Good to talk to you.